Hey everybody, Dr. Ed Gigliotti. Want to cover a really important topic today. It is, how can we adjust so gently with no twisting, popping, or cracking at UCC Rock and see such profound results? All right, let's dive right into it. So first things first, when anybody comes under care, the first thing we need to see is, are they a candidate? Is there something going on that we could potentially help with? Okay, so we're going to do on the first visit a complete history. We want to find out what's going on with the individual, with whoever comes in here's health. And then also, we're going to tie that into neurological indicators. We want to see how the central nervous system is operating. Upper cervical chiropractors, as you may already know, our whole goal in this office is to make sure that that brain can properly communicate with the body, and vice versa. Okay, you got trillions of nerve signals traveling every second from brain to body, and we want to make sure that those pathways are clear and there's not any what we call atlas subluxation complex, which would be an upper neck injury, right? Or a subluxation where there is a vertebra that's twisted out of place, causing dysfunction in those communication pathways. So how do you find out if that's occurring? You check the nervous system. You check testing. So this here is a very specific thermography scanner. So thermography scanner, it checks the heat in your neck. The reason why that's important is the heat is all regulated and controlled by how the blood flow is, or the inflammation patterns. That is controlled by the brainstem. So this is one test that we do in the office every time somebody comes in, and we do some more thorough and dynamic testing on the first time someone comes into the office, so we can get the baseline measurements to find out, is it showing that there's dysfunction within the nervous system. Another test we check is posture. The reason why that's so important is that brainstem area houses part of the anatomy called the reticular formation. I'm not going to quiz you on that. What that does is the reticular formation controls most, if not all, of our involuntary postural muscles. So how we stand, how our head tilt is, all of that is controlled through the reticular formation. So whenever there is a vertebral misalignment and there's pressure on that system, what they've known this for decades, science has known this. Many times what will happen is the posture will be distorted and a leg will pull short on that person. It's not that a leg is actually shorter than the other. It's that the muscles are firing improperly and pulling the hip up on one side. Okay? So we're going to be checking all these neurological indicators to see, okay, is there something that's actually happening? Is there something that's showing that there could be a nervous system injury, or there could be a vertebral misalignment, a subluxation, so to speak. Okay? Once we do that, many times it indicates that people are a candidate for care. So 3D imaging is what we do next. We have CBCT technology in this office. It's mind-blowing, this form of technology. It is really cool. And it allows us to get a 3D perspective on that person's spine. So that way we can find out, are there any injuries in the neck? Okay? And then if so, how are they? Once you can indicate how the vertebrae have twisted out of place, you can get a roadmap of how to address it. So we have all 4 of our clinic doctors reviewing these images, and then also we send the images out to a DAC bar, which is a chiropractic radiologist, to get a medical perspective and get a whole report. So that way we're not missing anything, and we make sure we're crossing all our T's and dotting our I's to serve everybody best. Now, the 3D technology, this is one of many images that it spits out. It is so amazing. Okay, so obviously this is a side view of someone's head and neck. So here's the chin, and this is the jaw, there's teeth, and then there's the neck. Okay, so a lot of times people might originally think, okay, well, if there's a bone that's twisted left or right or back or front, just push it back in position, right? There's a lot more to it, especially if you're looking for the best results possible with the least amount of force or very gentle adjusting. You have to look at how the bones are shaped. So it comes down to one word: hinges. Okay? This is how I love explaining it to people. You can have a 300-pound door, but as long as you know how those hinges are designed, you could very gently with your pinky finger move a 300-pound door effortlessly. Okay, as long as you do it along the hinge line. Now, in the same respect, if you pull on the top of that door down, right? If you're going against the hinge line, in all probability, you won't even budge that door. Doesn't matter how much force you use. So just looking at that last picture, each one of these vertebrae, as you could see, these joints are shaped a certain way that if you can get along those angles, depending on how the bone is misaligned, the more accurate you are along those angles, theoretically, the less force you have to use. It's like with a pinky finger moving a door. Isn't that cool? So I'll show you this. So with this individual here, and everybody's like, there's certain like ranges that people are going to fall into, the average person, but everybody's unique. So if you look at this, look at how the skull sits on the atlas there, and then the atlas on the second vertebra, and then look at the angles. Look how steep the second vertebra is, the C2 vertebra angle is. But then when you get down to the bottom of the neck, like C6, C7, look how shallow this one is. So the more specific we could get, like let's say if the second vertebra here went backwards on the right, let's just say, because this is the right side. The more specific we can get with the angle, the more gentle we could be with the adjusting. You got it? And what's really cool about that is that when you're that gentle and specific with the adjusting, if let's say the line of drive isn't correct or on the wrong angle, you can't create any new injury. It just won't move. Like if we're on the wrong angle, let's say, okay, it just won't move, and it'll show on the neurological indicators that the pressure hasn't been removed, that there's still dysfunction within that nervous system. So we know that we have to look at it a little differently. Okay. And this is why it's important. This here is that same view I just took. Okay. It's that exact same view I just took. But what it is we took all the bone away to now look down the canal. So here's the chin, here's the front opening of the skull, back opening of the skull. When we could find out how these vertebrae have malpositioned from an injury, if they're pushing on that spinal canal, they're going to be cutting down blood flow, cerebral spinal fluid flow, and nerve function going to and from the brain. And that's why the adjusting has to be so gentle, it's effective when it's so gentle and so specific, because we could very gently adjust on angles to start opening up that canal so the ligaments, the tendons, the fascia can start restructuring. And most importantly, the function can improve. You can have neurological tissue communicating better. You can have blood flow, cerebral spinal fluid flow, which some research indicates, if you saw my video blog last week, like almost instantaneous changes. It's amazing stuff. Now, this just is diving into it a little more. This here is the brainstem, and this is where the brain, obviously, right? And you look at what it controls. The brainstem and the central nervous system control virtually every single signal within you. Okay? Every single signal. It's like, that's why we're so particular and so specific and so gentle with it. Okay? Not knocking the way anybody else does it. There's other ways to serve, especially from a chiropractic perspective, but this is the way that resonates with us the most. And you might ask, okay, well, how do you do the adjusting? Sometimes it's done by hand, okay, really, really gently. But many times you'll see this instrument. This is called the KH2 instrument, okay? A technique called orthospinology uses it. So this little styloid here, you can adjust the speed and the depth. And we usually have it set around 1 to 2 pounds of force, so very gentle. So when you do it, it's like, many times people get their first adjustment, they're like, that's it? And that's all it has to be. If you're along those joint lines and you know how the vertebra is misaligned with advanced imaging, you can very gently adjust and get that pressure removed. It is cool stuff. And then this is what it'll look like. You'd lay on your side, and then we would have the measurements already in advance, and then there's the actual measuring tool on here too. It tells us angles. And then we can very gently adjust to get that pressure off. It's really cool. Love and appreciate you. I hope you guys found this valuable. If this resonates with you, please share it with someone who needs to hear it. There's docs all around the world who practice similar to the way we do. We do things a little bit uniquely because we were one of the first to get the 3D imaging back in 2016. So we sort of started advancing our research and our technique in a different direction. But we can help find a doc no matter where you are. We love and appreciate you guys. Hope you have an awesome day. Thank you.